Hello my dear friends, welcome to the Sandhya Nursing channel. So in this video we are going to discuss about the question paper of OBG. The year is 2015. So first we will see the meanings. First question is decidua. Decidua is the uterine lining during the pregnancy which forms the maternal part of the placenta, and it is formed under the influence of progesterone and forms highly characteristic cells called as decidua. So normally decidua is nothing but uterine lining, means the endometrium lining. The endometrium lining only is the decidua. So during the pregnancy it's called as a decidua. Decidua is nothing but the endometrium lining which is formed during the pregnancy on the influence under the influence of the progesterone hormone is called as decidua. So this is the meaning of decidua. Next question is attitude. So in the OBG the attitude meaning is the relationship of different part of the fetus to one another. It is the relationship of the fetal head and limbs to the trunk. It is called as attitude. So in the OBG, the attitude meaning is nothing but the part of the fetus to one part to the another. Example, head and limbs. Okay, the relationship or the coordination different part with the fetus, that is head and limbs. Next is presentation. So meaning of presentation. The part of the fetus occupies the lower pole of the uterus is called as presentation. Presentation is nothing but the part of the fetus. So whatever the fetus parts will be there, no? So that particular part will be present in the lower pole, then it's called as a presentation. Take an example, that may be cephalic, podalic, shoulder, or compound. Then now cephalic means it's a head. If the fetus head will be present in the lower pole, then lower it's called as a cephalic presentation. If podalic means if the fetus buttocks will be present in the lower pole of the uterus, then it's called as a podalic presentation. If the shoulder will be present in the lower pole of the uterus, then it's called as a shoulder presentation. Compound, then more than one part will be present in the lower pole of the uterus, then it's called as a compound presentation. So this is the meaning of presentation. One, the fetus part will be occupies in the lower pole of the uterus is called as a presentation. Next question is morning sickness. So what is the meaning of morning sickness? Nausea and vomiting. Okay, morning sickness is nothing but nausea and vomiting. Usually it's appear in the early pregnancy and due to high level of human chorionic gonadotropin or progesterone hormone called as morning sickness. So morning sickness is nothing but during the pregnancy the mother will be feel nausea and vomiting due to due to HCG due to HCG, yeah, right. HCG means human chorionic gonadotropin hormone will be increased, or may the progesterone hormone will be increases, no, then the morning sickness will be occur, then it's called as a morning sickness. This is some meaning. Now we will discuss the fill in the blanks. So first question is the normal length of the fallopian tube, that is 10 centimeter. Then second question is the fusion of male and female gametes is termed as fertilization. Right? Male and female gametes is termed as the fusion of these two gametes, then called as it's a fertilization. Next is normal weight of the placenta. So normal weight of the placenta is 500 gram or 1/6 of the baby weight. This is this is the normal weight of the placenta, that is 500 gram. Next question, the breast presentation denominator is a sacral. Next question is true. Next we will see the true or false. So first, true or false. First question is full dilatation of the cervix is a one of the prerequisite for the forceps delivery. Yes, true. Next question is tocolytic are used in the hypertonic contraction. No, this is a false. Next question, the umbilical cord consists of the two arteries and one vein. Yes, true. But if they called as initially it's present two arteries and one vein, then it's obviously false, because initially by the 4 months, the initially the umbilical cord contain the two arteries and two vein only. But after the 4 months, the one vein, the left one vein will be disappear. Okay, if they called initially at the 4 month, or at the initial, if the umbilical cord will present one two artery and one vein, then obviously it will be false only. And if they are not mentioned anything initially or else, then only they ask the directly the umbilical cord consists of two arteries and one vein, then the answer is true only. Next, the normal position of the uterus is a retroverted and retroflexal, false, because the normal position is anteroverted, right? So the it's a false only, because it's a retroverted and retroflexed. Next is choose the correct answer. The first question is, the milk expressed from the breast of the newborn during the first week is the which's milk, right? So sometime you may feel confused here. So in the correct choose the correct answer, they will be give here the colostrum also. But the colostrum milk is the mother's milk, not a newborn milk, right? So when the mother will be breastfeed, no, that time the initial the first week the colostrum, first 5 days the colostrum milk is produced, right? So that is the mother's milk, that is colostrum. Here they ask the newborn breast, so answer is with milk. Next question is, eutosia means a normal labor, if they called dystocia, and that is a difficult or abnormal labor. Eutosia means normal labor. Next question is, decidua is the name given to endometrium during the pregnancy, right? In the first question only, the decidua they ask, no, so decidua is nothing but endometrium lining only. In the pregnancy it's called as a decidua, but decidua is the endometrium lining during the pregnancy. If you have any doubt in these questions, then please let me know in the comment section. Thank you for watching.